wanted to ask you about the relatively new phenomenon of younger and younger women getting facelifts
Mhm.
and what you think of this, what the potential pros are, the cons are, how long a good facelift will last. And let's say if you begin at 30 or 35, how many facelifts you're looking at down the line if you want to maintain.
So, what I think is really important to understand about a facelift is that there should be some kind of criteria on which you have enough laxity, there has to be some standard because in theory you could do a facelift on every single person on the face of the earth. I mean, the same way that, patients say, well, should I start Botox before I've ever had a wrinkle? No, when you start to get little fine lines, we start to cross a threshold and say it's an appropriate treatment. The same thing applies to a facelift. There are non-invasive treatments that can yield excellent collagen stimulation, excellent elastin restoration, and give us essentially a nice long track so that we're supporting the skin and we're allowing it to, sort of slow down or sort of abort some of that aging process. And so going straight to surgery, let's say you've lost 100 pounds and you have sudden onset, really severe laxity, I could understand why you might need a facelift, but that is
Mm.
very, very rare circumstance. And so this idea that people are getting facelifts in their 30s, to me is really premature. And I think that there's a lot of controversy out there in the aesthetic community where a lot of surgeons are saying that, lasers and energy-based devices shouldn't exist at all. They serve a really beautiful purpose. And I think that, a facelift should be reserved for a certain kind of person who really needs surgical intervention. Generally, what we say, there's two kinds of facelifts that are predominantly popular in the world right now. One is called the SMAS facelift, which is sort of an older technology. It gives a slightly more subtle lift than sort of newer technologies. And so patients who want a more subtle lift, but do want to improve the line of the jawline, or they want to lift sort of the lower face, can get a subtle lift with a SMAS lift. For patients who have severe laxity or who want a more drastic lift, people are now referring to what's called a deep plane facelift. And so we usually say a SMAS lift in most people lasts about 10 years. A deep plane facelift can last 15 plus. But really, the truth happens. We continue to age even after we get a facelift. And so
Thank
having a
you.
facelift does not stop the aging process. Collagen breaks down. We live in a world with UV and pollution and free radicals and oxidation, and aging continues to happen. So you are not going to look 30 forever because you had a facelift at 30. You are going to continue to age from that same baseline.